You're watching Pyro Media Network.
Thank you for tuning in. If this is your first time joining us, welcome. We hope your experience is fruitful. Please feel free to visit our website to find out how you can join our growing family. While we are loading your experience, please do us a quick favor and hit that like button from whichever platform you're watching or listening on. Also, share so others may enjoy as well. And we hope you would consider hitting that subscribe or follow button so you can check out more of our amazing content. All right, let's start the show.
Hello, everyone. As you all know, my name is Dr. Nicole D. Vick. Welcome to this week's episode of Nicole D. Vick Live, where each and every week I go live to share with you important topics in the Black community from a social justice perspective. I am so very, very, very happy to have you. Now, this week, this is a recorded episode because I am traveling, y'all. I am in Phoenix, Arizona. I'm going to be presenting at a conference on Friday and also spending time with my one and only kiddo. You all know her, Andrea. She and I will be hanging out, and then I'm coming right on back. Woo woo. Anyway, the main focus of this episode was or is about National Minority Health Month, which is April. So there's a lot of things that happen in April. The first week of April is Public Health Week. And then the full month of April is National Minority Health Month. And I was curious to know, like, does this month look different now because of the new administration? What's really going on? So that's really what this episode is going to be about. But before I get into that, I wanted to share with you an epiphany slash update slash realization I had in regards to my ankle and the progress I'm making on my mobility. So I went to physical therapy. I go once a week. And I went to physical therapy on Cesar Chavez Day, which was March 31st, and was talking to the therapist about a whole bunch of things. And every time I go, she gives me a new exercise. And, hey, we're working on this, First it was it flexibility, and then it was strength, and then now it's balance, right? So there's, we walk and things and don't really think about the movements and the mechanics around walking. But me trying to learn to walk again, I'm like, this is crazy how much goes into literally putting one foot in front of the other. It's not just about putting one foot in front of the other. There's all this other stuff that happens. Anyway, so she showed me some new exercises and whatnot. And I was talking to her about the fact that I was a little bit frustrated. I was frustrated about my progress. So it was weird because I fully recognized that I have come a very, very, very long way, right? Literally not being able to move at all because of the injury, to finally getting surgery and having to recover from that, and then starting physical therapy, not being able to put any weight on my ankle to putting some weight on it, wearing a boot, and then going from a boot to a brace. So like there's been all this progress, and I'm not sitting here acting like I'm not aware of that. But I think what has happened is I've gotten so close to being fully mobile, but I still have some ways to go. And it kind of just felt kind of like, I just want to get there. So I was sharing with her my frustration, and she said, no, you've come a long way, Nicole. Every week you come in here, you have hit a new milestone. I'm always impressed with how you're moving forward. And so I was happy to hear that and whatnot, but it is what it is. So I came home, I took a nice nap. Oh, I slept good. I took a nap, And then around 7 o'clock, put on my shoes to do my exercises. And it was so weird. So I'm walking on my walk with my walker, and I'm like, my foot literally, I don't feel anything. And so if you've ever broken your ankle or your foot, it's going to hurt. It's going to hurt. Like even as you are recovering, it's something, some bone is going to be feeling away. It's going to be feeling weird. It is what it is, right? So I'm used to it. There's being some level of pain, but at that moment, I was like, I literally feel nothing. I feel like my regular self. This is crazy, right? I was like, what the heck? And then I got brave because she said, Nicole, you cannot move from a walker to a cane until you have mastered your balance enough. Because, see, the thing is with canes, I don't know if you guys knew this, you can't be putting your full body weight on that cane. That's not what the cane is for. The cane is more so to stabilize you. You still have to have balance. You can't. So, she said, you got to be able to sort of be comfortable with movement or walking and not having to rely on pushing your full body weight on a cane or a walker or something. Okay. All right. Just stay with me. Stay with me. I'm trying to tell y'all something. Okay. So again, I'm like, wow, my foot feels good. Wow. And then I said, let me try something. So, I was walking with the walker and I let go of one side of the walker. So my right hand, I just moved it away from the walker and I said, let me take a step. And I took a step. And then I took another step. And then I took another step. Now I was kind of limping, yes, but I was still walking with the walker with one hand. And I was like, what in the world? And so I started crying because I'm like, see, Nicole, you doubted the program. Being obedient. You doubted that for a second. The whole time you were being prepared for this moment and moving on to the next step. So that was wild. I just wanted to share that with you. I posted about it on LinkedIn already and shared it to some of my other social media channels. Like being obedient and just kind of following through and pushing through is like a thing. Like, what the heck? So yeah, I just wanted to share that update with y'all. I feel like hopefully in the next couple of weeks I'll have a cane. They already told me I can drive. And so I sat in my car. Now, if you know me, my car is very low to the ground. And I was like, I'm not going to be able to get in and out of this dang on car. But guess what? I got in and out of the car. Was able to put the walker in. And then my brother said, all right, I'm going to act like I'm not here. Get out. And I got out by myself. And I'm like, ah. So hopefully we'll be driving soon. It's just a lot going on. And I'm really, really, really super duper excited. All right, y'all. So let's jump into tonight's topic. Okay. National Minority Health Month. What is it? Where did it come from? Why? What happened? And where did it go? Right. So National Minority Health Month was officially recognized back in 2002. So we're talking 23 years ago. But it traces its roots back to National Negro Health Week. Now, did you know that its origins is in some Black people stuff? Founded in 1915 by Dr. Booker T. Washington. The goal at the time, or even now, or I guess not now, because it's gone, is to raise awareness about health disparities that disproportionately affect racial and ethnic minority communities and to promote health equity. Now, if you don't know what disproportionate means, it means like, hey, there are 5 people in this group of 100 people, right? There are 5 people in here. Well, let me say that another way because I'm about to mess this up. Disproportionate means that a disease or condition or health status affects a specific population or community at a greater level than in other communities. So, for example, HIV has a disproportionate impact on the Black community, right? Even though the Black community is a smaller percentage of a population, we're disproportionately impacted by HIV, for example. Or when you talk about Black maternal and infant mortality, for example. That's another one. Like, hey, the statistics and the rates are higher, and they don't match sort of the percentage of the population that the people sort of are in. I hope that makes sense, right? Where it's like if you say 5% of the population is black, I'm just making this up. Well, then how come 30% of that 5% has an issue? That's disproportionality. What's happening is out of proportion to the population of focus. Hope that makes sense. Okay. Now, why does all this matter? And I just kind of said it. Black Americans experience higher rates of chronic illness, lower life expectancy, and significant disparities in access to quality health care. I wrote an article about the issues around healthcare quality in the United States. What is wrong with it? And I used the example of my broken ankle and how it was dealt with as an example. Like, hold on now, y'all do us wrong. And there has been research on sort of how Black Americans, and I think specifically Black Californians, are treated differently in regards to healthcare. The other thing that's really important for us, structural racism in healthcare. It really leads to issues like implicit bias from providers. So going into a healthcare setting and not being believed, your pain being minimized, you being sent home when in your heart something ain't right and you get sent home, or actually something happening to you causing your disability or death. You end up with limited access to culturally competent care. In that article I was just talking to you about, I talked about the fact that we don't have enough Black physicians or Black folk in healthcare. And there's actually a very, very sort of intentional reason why Black folks have been kept out of the medical profession, because there should be way more Black doctors than there are currently in our country. Okay. Medical mistrust. Like, people say, well, why, why are you so distrustful? Baby, we got clear examples today. We ain't got to go back to Tuskegee. We ain't got to go all the way back to all that. There are things that are happening today in the healthcare field that make us feel like we cannot trust what's happening, right? Around vaccination, around other types of things, or just stuff that we're talking about here, implicit bias. We are not trusting of the medical industry. So this is really important. And we're going to talk about what's happening with this month and why it's going away. So this month was intended to serve as a call to action to address these inequities through policy change, community engagement, and education. So it was a really, really important resource. Now, there was a theme for 2025. But let me tell you what happened. So because I am a public health professional and my leanings and training is in public health, first thing I did was I went to the internet and I did my research. I said, I wonder what the theme is, the 2025 theme for National Minority Health Month is. Now, what happened was I went to Miss Google and I type it on up in there. And I got the dreaded 404 not found message. And I said, oh. And it's funny because I knew they were scrubbing websites and taking things down, but it was wild, I think, to actually experience it. I hadn't experienced it. So when I clicked it and it was like, oh, baby, it's not here. And I'm like, whoa. So it's not there. The website is not there anymore. But I guess maybe Google or some sort of AI was able to sort of capture maybe a previous version of the website. And it said that the 2025 theme was advancing commitments to eliminate health disparities. It is no longer that none of this stuff exists on the website anymore. If you don't believe me, you can go look. It's really, really crazy. So that leads me to the conversation around the current political climate and Black health. I can admit I haven't been watching so much about what's going on, like, every single detail, but I know people are being laid off that work in certain public health professions. CDC, FDA, folks are being sort of eliminated from their jobs. So that means that important things that are supposed to be happening aren't happening. I have heard that HIV funding, some of that is being, maybe all of it has been cut. And so what happens when you literally say we are no longer making an investment in the health of, and I don't like the word minorities. I do not, but that's what it's called. I don't like that. Minoritized, yes. Minority, no. I don't even like people of color either. So I'm like, I don't even know what we would call this month. How can I? Anyway, how will we ever address health disparities and try to achieve health equity if we are currently living in an administration that is actively sort of I can have you ever heard me be like at a loss for words, but literally like just snatching everything, just taking away everything. We are not going to be able to do it. And then the other part of it is I saw a list going around. I don't know how true this is. There are certain words that can't be used, like equity, um, disparity. Those kinds of words can't be used. So then if we can't talk about it, the website is gone, the resources are gone, the people are gone. How will we effectively eliminate health disparities? I don't understand how someone could make this make sense in the sense of making America healthy again. If you're not going to address the disparities and the inequities that cause some people to not be healthy, I don't get that. And so we're in a really weird space right now, at least as far as I'm concerned. I don't know what y'all are thinking and feeling, and so it's really bad. And I want to have some guests come on at the end of the rest of the month to talk through this from their perspective. And we're going to see, what their thoughts are. But there's some other things I want to touch on really quickly. Like, so then what is the impact? We're going to start to see greater health disparities. But the problem I'm having is, are we going to be able to like address them? Because we can't talk about them. So how will we measure it? You understand? Like, I don't get that. Um, we're going to start to see, decreased ability to address these issues in communities. The other thing I want to say, and then we're going to go to break really quick. Like, we all just went through a huge pandemic from 2020 to what, 2023, 2024. And I'm like, did we learn any lessons from COVID-19 in regards to the racial disparities that we're seeing in the data, right? Morbidity and mortality in healthcare access. Did we learn anything? Like, did anybody take any notes? Like, what happened? Where's the report to help us do better? Um, and I feel like we didn't learn anything because we're literally about to go through a similar situation. And now with this current administration, all we need is another pandemic. We're going to have the same thing happen. And I just wonder also if we are going to continue to disinvest in public health at the federal level, which will eventually trickle down to states and local. How are we going to be prepared to deal with any future public health crises? We have bird flu, right? And folks, the chickens are sick and all this stuff. Like, how are we going to be dealing with any public health emergency that comes up when we have literally taken away so much of our infrastructure to get the work done? So this year's National Minority Health Month is going to be, to me, a very sad time because I worry about what's going to happen in our future, how we will recover, because there will be a time where we're going to recognize, oh crap, we messed up. We don't have data. To me, data is like the, most important part of public health work. We have to know what the issues are and to what extent they are before we can really do anything to address them. But if we're not allowed to do the research, or the money has been pulled, and the staff and the resources have been pulled, how do we really know what's happening? How do we know how bad something is getting? How do we know, what we need to get things done if we don't understand what the problem is? And I mean, of course, to some degree, we already know what the problems are because they don't just go away because somebody says they go away, right? But again, we're losing some of that really important infrastructure on really learning how to, or even continually to address health disparities in this country. So I'm just really, really worried. All right. My worry is worrying me, y'all. We're going to go to commercial, and when we come back, I'm going to touch on some of the key health disparities affecting Black communities. Some of them I've talked about in the past. I'll touch a little bit on the social determinants of health and like who's doing what's going to what is happening now on the ground to address some of these issues. All right? So we'll be back.
What's going on, y'all? It's Kwame Speaks from Kwame Speaks Live, and you're watching Pyro Media Network.
Hey, it's Pastor Kim from It's Just Kim Live Show, and you're watching Pyro Media Network.
And we are back. Thank you. Welcome back. All right. So, again, this is National Minority Health Month, y'all. I mean, I don't know if this is official, but it was National Minority Health Month for April, but the website got taken down. I don't know what's going on. But I wanted to talk about it in light of the administration. So, when it comes to Black communities, where are we seeing these disparities and inequities happening? So you've already heard me talk about one, maternal and infant health, right? There are some disparities, and I swear I read something that said the numbers actually got worse over the last few years. They have not gotten better, they've gotten worse. So what that means is in the United States, Black women and their babies unfortunately die at higher rates, so that disproportionality I was talking about, than other moms and babies of other races and ethnic groups. And this is true regardless of the educational level of the mom, because what has been thought, well, if the mom is educated, has health care, then she should have better health outcomes for either herself or her baby. What we've learned is it actually doesn't matter, that Black women, regardless of health status, income, educational level, their health outcomes and birth outcomes are actually worse. And so it's just really crazy that some of the things that we think are protective factors are actually not for Black women. It's the stress, of being Black in America, the poor health care. We talked about implicit bias and some of the other issues around that. I think those things come into play. The other one is chronic diseases, right? We have disproportionate rates of diabetes, hypertension, and heart disease. And again, I always say this, I teach this to my students when I taught public health. Listen, it ain't a donut, a French fry, or a potato chip in the world that's doing this. This is the chronic stress in this country. When your body is stressed and continues to be stressed over a period of time, it starts to break down. That's where you see the hypertension, diabetes, and heart disease. Now, do the potato chips and the donuts help things? Probably not, but a lot of us live in communities where we got a lot of French fries and potato chips in our neighborhoods, and not a lot of fresh food and healthy food options. That's real. I talk a lot about this. The fact that I live probably less than a mile from a grocery store that used to exist, and it's gone, and it hasn't been replaced. And so there's lots of communities like that where there's lots of fast food and there's not a lot of grocery stores, full service restaurants, and other, reasonable food choices. And so add that to unemployment, underemployment, and all the other stressors. Yes, you're going to have a chronic disease, because your body over time, that stress is not going to allow for your body to sort of avoid it. It's not. Another one is mental health. There's barriers to access to mental health in a lot of Black communities. There's also a lot of stigma still. I think it's getting a lot better. I saw a snippet of, I can't remember the name of this show. I think it's Survival of the Thickest. And there were some Black guys playing basketball, and one of them was like, I think I need therapy. And his friends were like, man, yeah, I got a therapist. And so I think there's a lot of shifting that is happening, which I'm happy about, but there's still barriers to access. There's still a lot of stigma. And then there's really this lack of culturally competent care. I think we're getting better there as well, but we need more. We need more folks that look like us in these professions. And then the last one I think that's really important is environmental health. People don't really think about this in the way that I think that they should. There's certain policies on climate, pollution, and infrastructure that impact Black health in Black communities. What is it called? Cancer Alley, which is like, I forgot exactly where it is in the US, but I know like parts of the South are part of that Cancer Alley where there's a lot of industry and factories and things. Those things disproportionately, that word again, disproportionately impact Black communities. And so we're the ones that end up bearing the burden of these environmental decisions that are usually made due to money or other sort of reasonings. But we bear that burden of air pollution, lead, all these other types of things. So those are some key health disparities that really impact our communities. And once again, because it seems like National Minority Health Month and the work that goes behind it has been deprioritized, what will then happen in regards to these sort of really, really strong and troubling health disparities around these particular health issues? I don't know. I don't know. I don't know. And then if you take another dig, right, come down another level in public health, we talk about the social determinants of health, housing, education, economic stability. Those things have an impact on health outcomes. So those things play into the things I just talked about: maternal and infant mortality, environmental health issues, the chronic diseases. All of those things play a role. I just talked about food. So if you live in a food desert and you don't have access to quality nutrition, that has an impact on your health. What about stuff like criminal justice policies? We tend to not think of those in relation to population health, but they have impacts on mental and physical health, right? So I'm like, oh, I just really worry. And I know I keep saying that, but I don't know if I know the public health people in the world are like, I don't know if everybody else is like that. I don't think everybody else gets it. And that's what I think is my worry and concern, that we can't unring that bell. We can't unscramble that egg. Once this is messed up, it's going to take so many generations to put it back even to any degree of sort of functionality. It's just going to take a long time to undo what's being done. That's what's scaring me. So, like, what are folks doing? What is happening on the ground? And I could imagine, that there's a lot of work being done by community-based organizations and other organizations that are really trying to kind of bridge the gap. I don't know how much of the gap they can bridge, though, right? They also have limited resources, but there are orgs, at least that I'm aware of in California, that are like, oh my gosh. So, for example, California Black Health Network, right? They're trying to make sure that folks understand how to navigate the healthcare system. They have a How Do I campaign, and they have a host of other campaigns that are really focused on helping Black Californians figure out how to navigate the healthcare system. Now, in this instance, this is very specific, and it really doesn't address the issues of the lack of funding and some of the things that are happening at the federal level, but at the very least trying to make sure folks understand how to navigate what's here and what's now. Other organizations are like Black Women for Wellness, which I really love and admire. They're actually very, very local. Like, they're like down the street from where I live. And they do a lot of work on advocacy and whatnot as well, and programming too. And I know they do a lot of things on Facebook, and they have a lot of events and whatnot to get folks educated and informed. And then the California Black, I said California Black Health Network already. My bad. The California Black Women's Health Project is another one. And I know from my understanding, they focus a lot on maternal and infant mortality and making sure birth outcomes are good. And they also do quite a bit of programming. And so I would encourage you all to get familiar with these organizations, volunteer, because I know they always are looking for volunteers. A lot of them also have advocacy programs where you can actually learn how to advocate for policy and systems change. And the other important thing, let's be real, baby, is sending people some dollars. If you are a person that likes to donate and support nonprofit organizations, I just gave you three. Black Women for Wellness, California Black Health Network, California Black Women's Health Project. 3 organizations that you can literally spend your money, send them some dollars to help them continue to do the work that is so important in advancing health, at least here in California. Now, if you are in another part of the country, definitely take the time to look up orgs in your state or your county that you can support in some way. So, I think that's pretty much all I want to kind of touch on. It's a lot going on. It remains to be seen what's going to happen. Yeah, we just gonna have to stay vigilant, pay attention to what's happening. And one of the things I will say before I close officially, I had a conversation today, and I said, Nicole, you be always talking about, oh, we need to burn it down. And I said, wait, I didn't mean burn it down like this. This not what I had meant. No. But, on the flip side, I'm not going to say on the positive side, because I don't think there's anything positive about anybody losing their job or anyone losing important research funding. But I will say this could potentially be an opportunity to think about how we wish to rebuild. And can we rebuild in a way that is equitable? That, I think, is the question. And that is what we're going to need to be thinking about, because there will be an opportunity in time where we're going to have to go back and pick up the pieces and put stuff back together. Now, how we put it back together, that is going to be the thing that we're going to have to think about. Because if we don't put it together back right, and I know right is subjective, some people will like it and some people won't, but if we are not thinking about equity when we're rebuilding these systems that are being sort of dismantled, we will be right back where we were before. And I think that's something that we need to think about, because this is going to be a time where we're going to have to think about what's the next step. What's the point? What's the part where we start to rebuild, right? All right, y'all. Talk to you next week. You know where to find me. I have a website, www.NicoleDvick.com. I am on LinkedIn. That's probably the place I'm at the most at this point in time. You can follow me. My profile, I think, is Nicole D. Vick. Yeah, no, it's Dr. Nicole D. Vick, MPH. I think that's what it is on LinkedIn. Going back to my website, my bad, you can find copies of my book there. Pushing Through, Finding the Light in Every Lesson. Push Through, 52 Weeks of Light in Tough Times. And the latest one, Triumph in the Trenches. It is an anthology. I have a chapter in that book. I still have copies of that available to purchase. Again, I'll see you next week. Thank you all for listening. Hopefully this inspires some thoughtful conversation. I'm going to try to bring some guests on so we can, talk about it from different perspectives over the next 2 or 3 weeks. All right, y'all. You guys take care. Please take care of yourselves. It's a lot going on. And it can be frustrating, and it can be, it just can kind of pull you down. And I don't want us to be pulled down. I want us to remain hopeful and encouraged. All right. All right, y'all. See you next time. Bye.
Thank you for watching Pyro Media Network. For more information, please visit pyromedianetwork.com.